You've probably heard of vaginal laxity.
Oh, definitely. It's a huge topic.
Right. It's that frustrating feeling of looseness or just a noticeable loss of physical sensation during intimacy.
Yeah.
But what if that loss of physical sensation isn't always a structural change? Like, what if it's actually a hidden symptom of low sexual arousal?
I mean, that completely flips the script on how we view female sexual health, because we are trained to think of physical looseness as like a mechanical failure of the body.
Right, like a broken part.
Exactly. When very often it is actually a neurovascular issue.
Well, welcome to today's deep dive. We are thrilled you are here with us, listening in.
Mhm.
And to figure this all out for you, we are pulling from a massive stack of medical sources today.
A really dense stack.
Yeah, seriously dense. We've got clinical papers on the biology of female sexual function, guidance from the British Menopause Society, and also protocols from the National Institute for Health and Care Excellence, or NICE OWLS, over in the UK.
And the research in these documents is just incredibly revealing, especially when you start looking at the body as an interconnected system, rather than a collection of isolated parts.
So our mission today is to uncover this fascinating overlap between the physical structure of the female body and the neurovascular mechanics of arousal.
Right.
We're going to explore exactly how low arousal reduces sensation, how it perfectly mimics structural laxity, and how understanding this completely changes the way medical professionals should be treating female sexual health.
But I think before we can understand how laxity is being mimicked, we first have to establish what a normal aroused state physically looks like inside the body.
Oh, for sure, because it's not just a mental state.
Not at all. I mean, it is a profound, massive physiological shift.
So genital arousal is, at its core, a complex neurovascular event. Let's start from the baseline here. What is happening in the body before any kind of arousal begins?
Okay, so when a woman is in a basal or unaroused state, the smooth muscles in the vaginal walls and the clitoris are actually contracted.
Wait, contracted, not relaxed.
Right, they are holding a certain resting time,
Mm-hmm.
and they're keeping the blood vessels relatively narrow, which limits the amount of blood in the pelvic region.
Okay.
But then, following sexual stimulation, the nervous system sends a signal, and the body releases specific neurotransmitters, most notably nitric oxide.
Okay, let's unpack this because nitric oxide is the signal that kicks everything off. But how does a chemical signal physically change the shape of the tissue?
Well, it acts as a really powerful vasodilator. So nitric oxide signals those contracted smooth muscles in the arterial walls to just suddenly relax.
Oh, wow.
Yeah, and when they relax, the blood vessels widen dramatically,
Mm-hmm.
and you get this massive pooling of blood rushing into the pelvic region. It's a process called vasocongestion.
Vasocongestion, okay.
Right. The blood flow into the capillary beds increases so intensely that the vaginal walls actually change color. They turn a dark purple.
Wow, okay.
The clitoris extrudes from its hood, and these structures called the vestibular bulbs, which sit right beneath the skin of the labia, they swell significantly.
So the shape of the vagina itself changes too. I mean, it's not just a static tube that simply gets wetter.
Oh, no, it's incredibly dynamic. So
Yeah.
during this intense vasocongestion, the vagina actually lengthens and dilates, particularly in the distal two-thirds.
Wait, distal two-thirds, translate that for me?
Oh, sure. That refers to the deeper part of the vaginal canal, so the portion closest to the cervix.
Got it.
That area balloons out and lengthens to accommodate penetration, while the lower third near the entrance becomes highly engorged, and it actually tightens due to that swelling.
So is this, think of a self-inflating air mattress?
Okay, I like that.
Right. Like the outer fabric, the physical structure of the mattress is always there, but without the air, or in this case, without that massive blood flow, it feels flat.
Exactly.
It lacks tension, and it doesn't provide any real surface pressure. You just sort of sink into it.
That is a brilliant analogy, yeah. The biological swelling, that engorgement of blood in the lower third of the vagina and the vestibular bulbs,
Mm-hmm.
is the air in the mattress.
Right.
It creates the necessary friction, the tissue firmness, and the physical tension required for pleasurable penetrative sex. So without that swelling, the tissues remain completely slack.
So if that massive rush of blood is what makes everything feel firm and functional, it makes me wonder about the women who are actually diagnosed with structural laxity.
Right, because that's a real diagnosis.
Exactly. The sources do detail what true structural laxity is, and this is when the tissues are actually physically stretched or altered.
Yeah, there are very real structural causes for laxity, and we shouldn't dismiss them.
Right. We're talking about trauma from childbirth, especially if it involved, forceps or multiple deliveries.
Sure.
We're also talking about connective tissue disorders like Marfan's or Ehlers-Danlos syndrome, where the body's collagen is just inherently faulty.
Right.
And of course, menopause. The drop in estrogen causes the collagen fibers in the dermal layer to basically hyalinize.
Right. Which essentially means those collagen fibers fuse together. They become glassy and rigid, which causes the tissues to thin out and lose their natural elasticity.
Okay, but let me play devil's advocate here for a second.
Go for it.
If a woman has delivered 3 babies, you can't tell me her feeling of looseness is just a lack of blood flow. Like, the physical structure has to be permanently changed in those cases. She probably has true structural laxity.
Oh, you are bringing up a really vital point. Childbirth absolutely alters the pelvic floor structure.
Right.
But we have to look at the other side of the coin here. Even with some structural changes from childbirth, a healthy neurovascular system can compensate incredibly well.
Oh, really?
Yeah. The problem arises when a woman with those mild structural changes also experiences low arousal.
Ah.
So if she lacks that vital nitric oxide release, she lacks the vasocongestion.
The air mattress stays deflated.
Precisely. The symptoms of true structural laxity are a feeling of looseness, decreased sensation during intimacy, and reduced sexual satisfaction.
Right.
But without the tissue swelling and engorging with blood, there is a distinct lack of friction and sensation anyway.
Wow. Okay.
So the physical experience of low arousal is almost identical to having permanently stretched tissues. Therefore, low arousal perfectly mimics the primary symptoms of physical laxity.
So you're saying a woman might go to a doctor fully convinced she is physically ruined after having a baby, and she's asking for a surgical fix to tighten her up?
Yeah.
But in reality, while she might have, minor structural changes, the main reason she feels nothing is that her body just isn't getting the biological signal to engorge with blood.
Exactly. And the clinical data suggests this is happening in a huge number of cases.
That's wild.
It is the illusion of a severely stretched rubber band. The physical structure hasn't entirely failed. The neurovascular pump simply hasn't been turned on. And that makes the slight structural changes feel infinitely worse.
That is a massive paradigm shift.
But it really is.
But it brings up the obvious next question. If a lack of arousal can perfectly mimic physical laxity, why is that arousal signal getting dropped or disrupted in the first place? Like, why isn't the pump turning on?
Well, if we connect this to the bigger picture, we really have to talk about desynchrony.
Okay, desynchrony.
Yeah. This is a clinical term for when subjective arousal, meaning a woman's mental engagement, feeling mentally turned on, and genital arousal, which is the physical blood flow, simply do not match.
So the mind and the body are just operating on completely different frequencies.
Exactly. And female arousal is incredibly sensitive to disruption. Medications are a massive culprit here.
Oh, I bet.
Yeah, SSRI antidepressants, for example, are notorious for causing desynchrony.
Okay, let's dig into the how of that. Why does a medication designed to make you feel less depressed suddenly kill your physical arousal?
It all comes down to the neurotransmitters.
Yeah.
So SSRIs increase serotonin in the brain, which helps stabilize mood.
Right, that's what they're supposed to do.
Exactly. But they inadvertently blunt dopamine. Biologically, dopamine is the seeking chemical. It drives sexual excitement and anticipation. Serotonin, on the other hand, promotes a feeling of satiety and contentment. It basically tells the body, we have enough. We don't need to seek out anything more.
Wow.
So a surge in serotonin actively inhibits the arousal signal. The medication itself puts a roadblock between the brain and the pelvic blood vessels.
That makes so much sense. And aside from medications, our sources heavily emphasize the role of stress, relationship issues, or performance anxiety, particularly anxiety over body image.
Oh, absolutely. If you are distracted by negative self-talk or worried about how you look to your partner, your brain cannot positively engage with erotic cues.
You're just entirely in your head.
Right. You are physically present in the room, but mentally you are miles away.
Yeah.
And that mental distraction completely salts the nitric oxide release.
But there is also a physical feedback loop that causes desynchrony too, right? And this is where genitourinary syndrome of menopause, or GSM, becomes really critical to understand.
Yes, GSM is a major factor.
Because GSM acts as a total double agent here, our sources explain that when estrogen drops during menopause, it physically thins the vaginal tissues.
Right.
So you do get some of that true structural laxity and fragility we talked about earlier. But it also drastically reduces natural lubrication.
Yeah.
The vaginal pH changes, the healthy bacteria drop, and the tissue becomes incredibly dry.
And dryness almost inevitably leads to pain.
Hmm.
Dyspareunia, which is the medical term for painful intercourse.
And pain is like the ultimate arousal killer.
It really is. A healthy arousal response requires a very delicate balance between two branches of your nervous system.
Okay.
The sympathetic nervous system, which is your fight or flight response,
Yeah.
and the parasympathetic nervous system, which controls rest, digestion, and arousal.
So you can't have blood pooling in your pelvis for pleasure if your brain thinks you are under attack.
Exactly. When a woman experiences pain from dryness or extreme anxiety, it triggers that sympathetic nervous system.
The fight or flight.
Right. The body recognizes pain as a threat. So it immediately redirects blood flow away from the genitals and pushes it toward the large muscle groups needed for survival, like your legs and arms.
Just getting ready to run away.
Precisely. The arousal response is entirely shut down. So the GSM caused a bit of true laxity and dryness, but the resulting pain caused a total lack of engorgement.
Which makes the feeling of looseness and numbness so much worse.
Exactly.
Here's where it gets really interesting, though. Knowing this massive overlap between structural looseness and a lack of arousal-driven blood flow, how is the medical industry actually treating this? Because, I mean, are women getting the wrong treatments entirely?
It's a huge problem. The market is flooded with treatments marketed specifically for laxity, and it creates a very confusing landscape for patients.
Yeah, the sources talk heavily about energy devices. We're talking about expensive vaginal rejuvenation treatments,
Right.
like radiofrequency and CO2 lasers, things like the Mona Lisa Touch. And honestly, when I first read about this, I assumed these lasers were somehow tightening the muscles, like, I don't know, shrinking a wool sweater in the wash or something.
That is a very, very common misconception, and it's heavily fueled by aggressive marketing.
Okay, so what do they actually do?
These devices do not structurally pull muscles back together the way a surgical vaginoplasty would. They aren't sewing up a gap or mechanically tightening a muscle bed at all.
Wait, so these expensive lasers are actually intentionally damaging the tissue because the literature says they work through controlled thermal damage.
Yes, intentional microscopic damage. A fractional CO2 laser creates tiny microscopic lesions in the connective tissue of the vaginal wall.
Wow, okay.
And it's called fractional because it applies the laser in a grid pattern, so it leaves healthy tissue untouched between the lesions, which means the area can heal rapidly.
Right.
This thermal effect causes immediate swelling, but more importantly, it wakes up dormant fibroblasts.
And fibroblasts are the cells that manufacture collagen, right?
Right. Exactly. They are the builders of the tissue. So the laser stimulates neocollagenesis, the creation of new collagen, and neoangiogenesis, which is the formation of new blood vessels.
Oh, neoangiogenesis, new blood vessels. Okay.
Right. The laser is essentially using a targeted injury to force the body to biohack its own tissue.
That is fascinating.
It thickens the epithelium, increases glycogen, brings back the healthy lactobacilli, and most crucially, it vastly improves the microvasculature.
Okay, let's slow down and unpack some of those terms for a second because they are vital.
Yes.
The epithelium is just the surface lining of the tissue, right?
Right.
And what about the glycogen and lactobacilli? How does that work?
So glycogen is a type of sugar stored in the tissue. Healthy lactobacilli, which are the good bacteria in the vagina, they feed on that glycogen and produce lactic acid.
Ah.
Yeah. And that acid is what keeps the vaginal pH low. It prevents infections and maintains a really healthy, moisturized environment. When the laser thickens the tissue, it restores that glycogen supply.
So by bringing back that healthy bacteria, it's restoring the natural acidic environment and fighting off the dryness.
Exactly.
And improving the microvasculature just means rebuilding the plumbing, like the tiny blood vessels.
You got it. It's regenerating the tissue's capacity to hold blood.
Wow. Okay, so if you are listening to this right now and thinking your body is permanently broken, this is the mind-blowing part. These expensive laser devices are marketed heavily as a cure for structural laxity or looseness, but they aren't actually tightening the structural muscles at all. They are highly effective largely because they are artificially restoring the tissue health and the massive blood flow capacity required for arousal.
Right. They're rebuilding the plumbing so that the arousal pump can work again.
They are fixing the self-inflating mechanism of the air mattress, not replacing the plastic shell.
That's exactly it. The tissue restoration leads to better natural lubrication, less pain, and a much greater capacity for that vital engorgement during sex, which in turn cures the feeling of laxity.
But wait, While lasers and hormone creams are targeting the superficial tissue and the blood vessels, there is a foundational non-surgical treatment prioritized by medical bodies that targets both the physical structure and the arousal mechanics simultaneously.
Right.
And it doesn't cost thousands of dollars out of pocket.
Which raises an incredibly important question, doesn't it? Why jump to invasive, expensive energy devices when neuromuscular control solves both sides of the equation?
Right. And we're talking about pelvic floor muscle training or PFMT,
Exactly.
good old Kegels, but done correctly. Ideally under the guidance of a pelvic floor physical therapist. I mean, it's not just indiscriminately squeezing while you're at a red light. It's learning the mind-muscle connection to really lift and release.
Yeah, the UK's NICE guidelines specifically prioritize this approach. They actually do not recommend the routine use of energy devices for laxity.
Oh, really?
No, they explicitly tell clinicians to start with pelvic floor rehabilitation.
Because it acts as the ultimate crossover cure. Let's look at the mechanics here. On the structural side, training these muscles improves their resting tone, right?
Yes.
A stronger, thicker muscle bed physically combats true structural laxity. It builds up the foundation from underneath.
And then on the arousal side, the mechanism is just as powerful. The pelvic floor muscles wrap right around the base of the vagina and the clitoris.
Okay.
So when you repeatedly contract and release those muscles during targeted exercises, you are manually acting as a pump. You are actively driving massive amounts of blood flow right into the genital tissues.
So you are basically kickstarting the vasocongestion yourself.
Absolutely. Over time, this enhanced neuromuscular control improves the body's natural ability to lubricate, engorge, and experience sensation.
Wow.
Furthermore, having conscious control over these muscles helps women learn how to actively relax them when needed, which prevents the muscle spasms and pain associated with dyspareunia.
It's incredibly empowering to realize this. I mean, for you listening right now, if you've been struggling with this feeling of looseness or a loss of sensation, you don't necessarily need a high-tech laser or a surgical suite to fix it.
Not at all.
Training your mind-body connection to isolate and contract these muscles can prime your body's natural arousal pump while simultaneously giving you that structural support. It puts the control completely back in your hands.
It is a foundational intervention.
Yeah.
And it's entirely risk-free and treats the root cause of both the physical and the sensory deficits.
So what does this all mean? We've covered a lot of dense biology today.
We really have.
But the core takeaway is this. The feeling of vaginal laxity isn't always a permanently stretched rubber band. Very often, it's an intricate, beautiful neurovascular system that simply lacks the right biological and psychological conditions to engorge and create sensation.
And it is about understanding that your mind, your hormones, your blood flow, and your muscles are all constantly speaking to each other. When one stops communicating, whether that's due to an SSRI, stress, or a drop in estrogen, the whole system feels the impact.
Navigating this kind of medical information can feel completely overwhelming.
It can.
The terminology is dense, and honestly, society doesn't make it easy to talk about this stuff openly. But understanding the simple mechanics of blood flow completely changes the paradigm of female sexual health.
Yeah, it really takes the shame out of it.
Exactly. It moves the conversation away from shame and this whole idea of being broken and moves it toward biology and optimization.
Because knowledge really is the best medicine here.
Yep.
When you know how the system is supposed to work, you can figure out exactly where the disconnect is happening rather than just treating a symptom in isolation.
Which brings me to a final thought I want to leave you with today to mull over.
Okay.
Our medical culture so often jumps to treating women's bodies as broken structures that require surgical or high-tech fixing.
Right.
But considering how closely low arousal perfectly mimics a loss of structural integrity, how much of female sexual dysfunction is actually just a perfectly healthy body responding exactly as it should to a stressful, exhausting, or unarousing environment?
That is a really powerful reframe. I mean, it changes everything about how we approach treatment.
Yeah. Maybe we've been so focused on looking at the physical structure, we entirely forgot to look at the blood flow that brings it to life. Well, until next time, keep driving deep.